Hey, this is Greg Warmbier. I'm actually here with Dr. Amy Wicks. She's actually in St. Charles, Missouri. She's got a wonderful practice, the Center for Natural Health. I've had the pleasure of actually meeting her, but I went to St. Louis, meeting her family. I get a chance to meet some of the staff she has. It's been absolutely fantastic working with Dr. Amy, but I wanted to interview her and talk a little bit more about the X39 patch. So Dr. Amy, tell me a little bit more about your practice.
Well, it's in St. Charles, Missouri. It is a holistic chiropractic office. We do adjustments, we do acupuncture. We work a lot with hard to treat conditions that other doctors get stuck on and struggle with, like chronic issues. Yeah, and I have two other associates who work under me.
Fantastic. And then how did you find out about X39?
Well, I went into a thyroid storm back in Thanksgiving last year and spent 2 weeks in the hospital. Had to undergo a total thyroidectomy on December 8th. With that, I was struggling with my recovery. I was sleeping all the time. I was tired. My brain was not working how it would typically work. It was very like a snail. And then on January 19th, I believe it was, a friend of mine who owns a salon, I was getting my hair done and I was falling asleep in her chair. And she just looked at me and she's like, "Here, put this patch on." And I said, "What is it?" And she goes, "It'll help you feel better." And I said, "Okay." Well, normally when somebody's handing me something, my left brain is wanting to know the answers and the details and everything. But in the state of mind I was in, I did not care at that point. So I was like, "All right, whatever. I'll stick this little sticker on. It can't hurt me." And within an hour or so, I just had a complete change in my energy. I had increased energy. My brain activity was back. I was my old self. I even went out to dinner that night with her and another friend, and I
Wow.
was like back to my old self. So that was enough to pique my interest.
Mhm.
And 4 days later, I still knew nothing about this patch. She could not explain to me what it was. So I
Mhm.
was like, "All right, well, I'm feeling good. That's fine with me." 4 days later, a patient walks into my office wearing this patch. And I said, "Oh, I know what that is." And she said, "You do?" I go, "Actually, I have no idea what it is." I go, "But I am wearing it. And I'm feeling good." I go, "But I need a left brain logical explanation to what this is and what it's doing."
Wow.
And she said, "Okay, I'll take care of that left brain." And so she sent me to thisisit.info.com. And then she sent me another video of David Schmidt talking to healthcare practitioners. And I looked into that. I researched for a couple days straight because I had a little extra time on my hands because I wasn't on a full load of patients yet. And I was blown away actually at the research that has been done, all the research on phototherapy in general on PubMed that I did not even know existed.
Yeah.
Uh, and I just was like, this is interesting. This is going to be really good for the practice. And that's how I got involved.
Wow, that's awesome. And you hear about these stories and it's amazing how it's changed your life. So then you started implementing in your practice. So how did you implement it in your practice?
Well, it was a little natural flow for me because my patients saw a visible difference in me very quickly. And so they just naturally asked me, what are you doing? What changed?
Mhm.
And so I just started telling them about the stem cell activation patch.
Mhm.
And then it occurred to me, I was like, you know what? I'm going to have my 30 toughest patients as kind of an experimental type group to see if they get good results too.
Yep.
And so they agreed. I was about 30, give or take. And they're like, "Okay, we're in." I was like, "Give it at least 3 months because that's about, 90 days to go
Mhm.
through cellular regeneration to see if it's doing anything." And it's in the high 90 percentile. I'd say 95 to 97% of the people within 3 months noticed significant improvement in all kinds of different issues.
Wow.
Um, yeah, and most of them were in the first 30 days, but there are a few that took longer than 30 days. So I encourage them to stick with it, and they did. And I have a high percentage that have remained on the patch,
Yep.
and they're loving it. They're enjoying it.
That's amazing. So, and that's the part I think about, that you've not only saw the benefit yourself, but you wanted to share it with other people. And so has this helped your practice grow? Have you seen a difference in your practice using this X39 stem cell activation patch?
Yeah, they're sharing it with their family and friends too because they're feeling good, so they want to share it.
Yeah.
I kind of joked about Josh, who you know, and
Mhm.
said like, "Oh, no, 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 I want nothing to do with this. We're just going to use the patch." And he was like, "Okay." And lo and behold, it worked that well. People wanted to know more about it,
Mhm.
and so here I am, and God has just blessed my practice with it.
Yeah.
I've seen I had a patient just a couple weeks ago, about 5 months he's been on the patch, and he went from stage 3A kidney disease to stage 2. And he
Wow.
has not changed his diet in any way, shape, or form.
Wow.
I had another patient with dementia. He was diagnosed with dementia. He saw his neurologist. Again, this is about 5 or 6 months he'd been on the patch. And he passed his cognitive test with flying colors, but not just passed it, he was responding quickly, his wife said. We've seen thyroid levels go down, while thyroid medication needs to get decreased because their thyroid levels are improving.
Yeah.
I've had, what is it, pulmonary fibrosis, actually. A patient, my sister actually is a good friend with that, and so she convinced her to try it. As her friend said, she's probably the most skeptical person in the world, but she's like, I have nothing to lose at this point, because she was diagnosed about 3 years ago, but they forgot to tell her she was diagnosed a year earlier. So 4 years into a typical average 5-year diagnosis. And so she put it on, and within 30 days, she was like, I can breathe. I can shower without resting. I can do this. She's just amazed at the results. So we're curious. She just started. That was about a month ago. So we're curious to see what her O2 levels are when she goes in a few weeks.
That's absolutely amazing. So would you recommend this? I know you have other, chiropractors, other doctors you talk to. Would you recommend this to other physicians and people that are obviously in the same space that you are?
Yeah, actually, I think everyone in my office now is wearing the patch and recommending the patch. The other two associates that work for me have been recommending it to their patients.
Yeah.
I even have I have a medical doctor and a few other chiropractors on my team who have implemented it into their practice, and they're seeing results with their patients as well.
That's
it's mind-boggling.
That's a good word, because that was like the same thing for me. So I'm so grateful. Thank you for taking time today away from your busy schedules. Again, I was hoping you could be live with us, but I'm so glad you recorded this so that we could actually share with others how this has benefited so many people. So God bless you. Thank you so much. I really appreciate your time.
Thanks for having me.
Absolutely. Thanks.